Hello, my name is Lieutenant Commander Chris Carr, and my purpose today is to put together a knot tying tutorial. I work at the Bremerton Naval Hospital as a surgeon. The primary sources for this tutorial in knot tying, especially knot tying in the OR and for minor procedures in the office, is my training from Vanderbilt University Medical Center and also from this book put out by Randy Penn. It's a book on all kinds of knots. With that, I want to give a very brief overview of knots. There are hundreds of different kinds of knots, and to give some broad categories, there are stopper knots, which we can tie on the end of a rope to prevent anything that's on the rope from falling off. There are binding knots, which are knots that bind a group of objects or even a single object. These are the knots that we use in the operating room. Specifically, we use square knots, also known as reef knots, and surgeon's knots. Occasionally, we tie granny knots as well. There are bends. Bends are knots that attach two ends of a rope together, either on the same rope, the two ends, or two separate rope ends together. One can think of this as maybe doing so for a necklace. There are also loops that can be tied. These are rarely tied in the operating room, but it's another broad category of knots. The last category of knots that I want to discuss are hitches. Hitches are when rope is bound to an object. I will give an example of a couple hitches, and this is mainly meant for people who camp, for military personnel who are on deployments, for hikers, those sorts of things. So let's get started with the main purpose of this tutorial, specifically for binding knots that we tie in the OR or for minor procedures. These are specifically going to be the square knot and the surgeon's knot, and I will do a two-handed tie and a one-handed tie as well. Before getting started, I want to talk about this piece of rope that I'll be using. This is not a suture. I believe that it is best to learn on larger pieces of rope before learning on smaller sutures. This is 550 cord, also known as paracord or parachute cord. Why 550 cord? Because it can withstand a load of 550 pounds. I chose this because it's easy to tie, it's large, so it's easy to see as well. And one of the keys when learning knot tying is to make the knowledge declarative knowledge first, cognitive knowledge, before it becomes procedural knowledge and muscle memory. I say that because if you have a good understanding of how knots are constructed, then you will be better able to problem solve when you're not tying knots correctly. So as I get started, this piece of rope has half of it that has been painted white. Some of the paint's coming off. And the other half is black, it's natural color. Before I start the actual knot tying, I want to talk about a couple terms. Terms such as working end, non-working end, running end, and standing end. When I use these terms, the working end is synonymous with running end, and non-working end is synonymous with standing end. The working or running end is always the end that is being passed through the loop. Hence, it is doing all of the work. The non-working or standing end is the end of the suture or rope that is not being passed through the loop. During this tutorial, I'm going to attempt to make the colored white end of this 550 cord the working end or the running end. Therefore, the end that is passing through the loop to create the knots. I will be tying this cord to a wooden object on a stool. All images will be coming over my right side, essentially over my shoulder, so the learner or viewer does not have to use mirror images to learn these techniques. When tying an object, or in the OR in our case, a blood vessel, when you're holding the suture, generally the suture that is away from you is begun with the finger. This first knot will be a two-handed tie. The finger will start on the loop that is away from you. The first object is to create a loop, then pass the working end through the loop, and then bring the half knot down to the object in a controlled fashion. The suture or cord is held across the palms. One must learn how to control either strand of the suture with both hands. I do so with the last three fingers of each hand, freeing up my thumbs and my index fingers. Those three fingers control the strand. Then, this is my right-handed tie, which means that my left hand is controlling the standing or non-working end, and my right hand is controlling the working or running end, the end that passes through the loop that we create. Using my left hand to set up the non-working strand or standing strand, I rotate my index finger, which is in the shape of an L with my thumb, my index finger over, around, and under the standing strand. Then I create a loop by passing the running strand or working strand in my right hand over the non-working strand, thereby creating an X and a loop. I cross it approximately over the distal interphalangeal joint or the proximal interphalangeal joint. And I don't let go in real practice of my working strand until I'm ready to pass it through the loop. In order to pass it through that loop, I must bring my thumb and forefinger, which I pinch together, through the loop. A common mistake for beginners, for learners, is to actually pinch the two strands where they cross. You don't want to do that because then it's hard to pass your thumb and forefinger through the loop. Now, why do I pinch my thumb and forefinger together and pass it through the loop? By rotating my hand. Why do I do that? Because that's the mechanism by which I pass my working strand through the loop that I have created. I pass the working strand between my forefinger and thumb, and then I rotate my forefinger and thumb together back through the loop, handing my working strand back to my right hand. At this point, I have a flat half knot, just a half knot. I want to keep it flat by bringing it down to the tissue in a controlled fashion. This can be done with either my right forefinger or my left forefinger. And this oftentimes will depend upon the exact position that one is tying tissue within the body. In this case, I'm going to use my left forefinger. Bring it down snug to the tissue. There are two ways in snugging to the tissue. One way that is taught is to bring your finger right down on the knot. The other way that is taught is to bring your finger just next to the knot, thereby passing it just beyond the knot to get it as tight as possible. Let's do that again. Much of this will be repetition, because I think repetition with procedural things is one of the best teachers. Teach yourself how to hold the suture. Control with the last three fingers of either hand. Have your index finger and thumb in L configurations. Set up your first half knot. with your left forefinger rotating around and under the non-working strand. Create your loop by passing the working strand over the non-working strand. Pinch your thumb and forefinger together. Rotate that mechanism through the loop in order to capture your working strand, which is placed in between the forefinger and thumb. Rotate the working strand back through the loop. Re-grab it with your right hand, and then bring the knot down to the tissue in a controlled fashion. One more time. Set yourself up by holding both strands comfortably, last 3 fingers, gently grasp. L shape between your forefinger and thumb on either side. This is a right-handed, two-handed tie. Therefore, set your non-working strand up with your left forefinger by rotating around and under. Create your loop by crossing the working strand in your right hand over the non-working strand, creating your loop. Pinch your thumb and forefinger together. Rotate them through the loop to capture the working strand between the thumb and forefinger. Rotate the thumb and forefinger back through the loop. Re-grasp with your right hand. And bring the half knot down to the tissue in a controlled fashion. Now for the second throw, in order to make the square knot, we need to set it up differently. Now look, when you're done this throw, the non-working strand, which was up superiorly, is now 180 degrees opposite from where it started, down inferiorly. Now that it's down and closer to me, I'm going to set it up with my thumb. I'm not going to rotate my forefinger around and do the same throw because I cross my strands, and at best we will get what's called a granny knot and may not even get that. In order to get the square knot, which is a better binding knot than a granny knot, I must set my throw up with my thumb. So instead of rotating my forefinger around and under my non-working strand, I'm going to rotate my thumb internally around and under my non-working strand. Then I'm going to create my loop by passing my working strand over my non-working strand in the crease of my thumb. I leave the tip of my thumb free so it can pinch to my forefinger. I bring my forefinger and thumb mechanism through the loop by rotating my hand and wrist and even part of my arm through the loop. I capture the working strand between my thumb and forefinger, and I rotate it back through the loop and re-grasp with my right hand. And I bring the second half knot down to the first in a controlled fashion. Bring my finger all the way down onto the knot to tighten it, or just next to it and beyond it to get maximum tightness without putting too much tension on the actual tissue. When you look at a square knot, if it's showing up on the camera, the painted part of the cord comes out together. The working strand is next to its white loop. The non-working strand, the black part, comes out right next to its initial loop around the tissue. That configuration automatically tells you that it's a square knot. And if you know that configuration, you can look at a knot and tell if you're tying it as square knots, if that's how you wish to tie your binding knot. So let's do it again. We're going to start to go a little quicker on some of this. Hold your sutures in the last 3 fingers. Create L shapes in either hand with your forefinger and thumb. Use your left index finger to set up the first loop. Pass your thumb and forefinger through the loop. Capture your working strand. Bring it through the loop. And then bring your knot down in a controlled fashion to the tissue. Then set up your next half knot for the square knot with your thumb by rotating it medially under and around your non-working strand. Cross your working strand over it to create your loop. Pinch your thumb and forefinger together. Grasp your working strand, pass it through the loop. See how my whole arm and wrist and hand rotates? Regrasp the working strand and bring it down in a controlled fashion to get your knot. If you look at this, I actually tied this incorrectly. This is a granny knot. This knot, if you look closely, the working strand white part comes on the other side of the prior half knot. It is not immediately next to the white loop. That is a granny knot. Let's tie the square knot and the granny knot again to see the difference one more time. The working strand is the white strand. Set your first throw up with your left index finger. Pass your working strand through the loop. Bring the half knot down to the tissue in a controlled fashion with your finger, with your index finger. Set your non-working strand up again with your thumb. Create your loop. Pass your thumb and forefinger through the loop. Bring your working strand back through the loop and regress with your right hand. And then bring it down in a controlled fashion to the prior half knot. That is a square knot. The two strands come out right next to each other underneath this loop. And the same on the other side. These two come out next to each other above this loop. Now for the granny knot. Granny knot, you start the same way. Create your first half knot. And then for the second one, you do the same throw over again. You set it up with your finger again, not your thumb. You can see how the strands actually cross. But you must bring it down flat to get a true granny knot. When you look closely, you can see how the non-working strand comes out on either side of this white working strand, and the working strand comes out on either side of the black non-working strand. Both the granny knot and the square knot are binding knots. The square knot is a better binding knot and will control vessels more reliably when you're trying to control bleeding.
Go ahead.
My next objective is to discuss some pitfalls of knot tying. One of them is when you throw your half knots, you do your half knots, if you leave yourself a lot of suture, you create larger loops through which it is easier to pass your working strand. And that's a good thing. However, you must teach yourself how to shorten the working and non-working strands in your hands in order to get your index finger near the half knot to bring it down to the tissue in a controlled fashion. My fingers aren't long enough to get it down there. So I've taught myself to shorten the strand by rotating my last three fingers over and around my working strand. I pinch with my thumb and forefinger, control the strand, and then I rotate my last three fingers around my strand, I re-grasp, and I slowly pull back until my forefinger is right next to my knot again to continue bringing it down. Or with my left hand, I do the same thing if that's the way I want to bring it down. Pinch thumb and forefinger, rotate my last 3 fingers over and on my non-working strand, pull back slightly, keeping grasp of the non-working strand till my forefinger is right next to the knot. And I'm re-grasping with my middle finger and my thumb to bring it down. Do the same thing with my working strand if I need to. Rotate my last 3 fingers in, re-grasp. Then I grab the working strand with my thumb and forefinger, allowing my index finger to come right next to the knot. You can train both hands to shorten the strands in a controlled fashion depending on which forefinger, index finger you want to bring the half knot down to the tissue with. So again, if your strands are long, you need to shorten the strands to get your finger near the knot, to bring it down to the tissue in a controlled fashion. A good exercise with suture, or if you're starting with cord, is just to grasp and rotate your fingers in. Pull back, grasp. Grasp, slide your 3 fingers on it. Middle finger and thumb, forefinger on the knot. Do the same thing with your other hand. Shorten in a controlled fashion, getting your forefinger closer to the knot to control it, going down to the tissue. Another pitfall is when the knot tire does not bring both the working strand and non-working strand to the tissue with equal tension. When unequal tension is placed on either the working strand or non-working strand, even at the last second, the unequal tension can convert a flat half knot, which is what you want, into a half hitch, which generally is not what you want. Your flat half knots will lead to square knots, or at least granny knots, both of which will hold much better and not slip as easily as half hitches. Let me show you what I mean. Do 1 half knot, bring it down to the tissue, then set your next one up with your thumb to get a square knot, and you want to bring it down flat. So you have to have equal tension on your non-working strand and your working strand to keep it flat going down all the way to the last second. If you pull up even the last second, it converts that half knot into a half hitch, which slides along the standing strand. And if you keep on doing that, you're throwing it down flat, flat, flat. At the last second, you pull up on either strand, you create it into another half hitch. Half hitch. And half hitches are much easier, more easily slide. Ultimately, that is not what you want. You want flat half knots to create square knots, or at least granny knots. Sometimes throwing half hitches can actually be of use, and this is at the beginning of creating a knot on tissue that may have a little bit of tension to it. Throwing 2 half knots and converting with unequal tension to a half hitch throw the same half knot twice. I'm using my finger to set it up both times. And I'm pulling unequal tension. I'm keeping my non-working strand with a little bit of tension, keeping it straight, and I'm half hitching those two throws on top of one another. Those two throws will slide along my non-working strand, allowing me to slide the knot all the way down, approximating the tissue edges. This is a technique that you would use when your initial knot is not staying and you want to remove air from the very first knot. At some point, you have to throw a square knot, or at least a granny, to get a binding characteristic and prevent it from slipping. So I threw 2 half hitches to slide that first knot to the tissue, and then I threw 2 square knots on top of it to bind the knot and prevent it from slipping. The key is to know when you're tying a square knot, when you're tying a granny knot, and more importantly, when you're tying hitches. And if you want to tie hitches, then you do so intentionally. You do not want to be in the situation of tying half hitches that are more likely to slide without knowing it. The next thing I want to show you is what a group of half hitches looks like grossly. I find this important sometimes to test myself when I have sewn a large fascial stitch, say in the linea alba of the abdomen. That suture is thick enough to take one look at it after you're done sewing it and know if you tied square knots or a group of half hitches. And in that kind of tissue that is under a lot of tension when that patient wakes up, I like to know if I indeed sewed or tied square knots and not half hitches. A group of half hitches created with unequal tension on one of the strands looks like this. I'm throwing the same half knot over and over again. You actually don't have to throw the same half knot over and over again. You can think you're sewing a square knot by sewing both parts of the square knot, setting up with your finger and then your thumb. But if you pull up unequal tension on the 2 strands, you'll convert both those half knots into half hitches. If you look at this series of half knots, which I converted to half hitches, you can see how there's a nice spine to the hitches. And they are basically encircling or hitching around the non-working or the standing strand, this strand here. That can slip pretty easily. That's my non-working strand being slipped out of 1, 2, 3, 4, 5, 6 half knots, which were converted into hitches. And it is exceedingly easy to convert what you think is a square knot or a square half knot into a half hitch. And if you know the configuration grossly of a group of half hitches, you can look at a knot when it's finished and know if you indeed tied square knots or if you mistakenly converted them into a series of half hitches that can slide. And this I definitely want to know on thicker tissue that's under tension when a patient wakes up. Now let me show you what a group of square knots looks like. My white strand here is still the working strand. Got to keep equal tension on both strands all the way down. Now look at this. These are square knots, 1, 2, 3, 4 square knots. That's not going to slip. There's no way of slipping my non-working strand over my working strand, or vice versa. That's a secure bind-it knot, bound knot. For left-handers, the right hand will control the non-working or standing strand, and the left hand will control the working or running strand. I'm going to do this one time for left-handers so they can see this in slow motion and not have to do any kind of mirror image of a right-hander. Once again, grasp with your 3 last fingers gently, L configuration of thumb and forefinger. In this case, the right forefinger will rotate around and under the non-working strand, setting it up to create a loop by passing the working strand in the left hand this time over the non-working strand. Pinch your thumb and forefinger together, rotate them through the loop, grasp the working strand between thumb and forefinger, bring it back through the loop, re-grasp with the left hand, and then bring your knot, or your half knot, down to the tissue in a controlled fashion. The second throw is set up with the thumb. Rotate around and over the non-working strand, pass your working strand over the non-working strand, creating a loop. Pinch your thumb and forefinger together, rotate them through the loop, grasp your working strand between thumb and forefinger, rotate thumb and forefinger back through the loop, re-grasp the working strand, and bring it down to the tissue in a controlled fashion to create your square knot. Now that was a demonstration of a right-handed, two-handed knot, both square and granny. Mainly you want to know the square knot, and then also at the end there, a left-handed, two-handed knot. I also want to show an example of one-handed knot tying. Before I do that, I want to show a surgeon's knot. A surgeon's knot is when you bring the working strand through the loop that you create 2 times for the first throw, for the first half knot. So grasp your 2 strands of suture or cord. This is going to be right-handed. Rotate your left forefinger to set up your first throw. Make your loop. Pass your working strand through the loop once. Re-grasp it. Pinch your thumb and forefinger together again. Pass those through the loop and re-grasp your working strand again. Now you have rotated your working strand through the loop 2 times. Bring that down to the tissue in a controlled fashion while keeping it flat. Do not convert it into a hitch. In your second throw, to square it, will be set up with your thumb. And bring that down flat to the tissue by keeping equal tension on your non-working and working strand all the way down to the very end. Why do a surgeon's knot? Because a surgeon's knot has 2 wraps in the first half knot, in the first throw. Those 2 wraps create more friction between the 2 strands of suture. If there is more friction between the 2 strands of suture, then it's more unlikely for that first half knot or first throw to slip while you are tying the second half knot to complete your full surgeon's square knot. For left-handers, the surgeon's knot is done in a similar way, except the right hand controls the non-working strand, and it will set up the first loop with the right index finger. The working strand crosses over the non-working strand, creating a loop. Then the working strand is passed through the loop with the thumb and forefinger 2 times. Creating 2 loops around the non-working strand. Bring that down flat to the tissue in a controlled manner, keeping equal tension on both the working and non-working strands. And then complete your surgeon's square knot by doing the second throw, setting it up with your thumb. And that is a square surgeon's knot. Once again, the 2 loops on the first throw or half knot creates more friction between the 2 strands, making it harder for the 2 strands to slip. The next series of knots will be one-handed square knots. I would suggest learning at least the 2-handed knot tying technique. If you know that, that's actually enough, and that's all you need to know. To increase the speed of knot tying a bit, a one-handed technique can also be learned. Sometimes this can be used when tying sutures that have been thrown with an instrument as well. But let's focus on knot tying now with a one-handed technique. Once again, start by holding the sutures similarly. This time, this is going to be a right-handed technique. The right hand will control the working strand. Pinch the working strand between your thumb and forefinger. Rotate your 3 fingers on top and into your working strand. Cross your non-working strand over your working strand around these 3 fingers, thereby creating a loop. Then keep those 2 strands crossed and use your middle finger to come over the non-working strand and under the working strand and pinning it between the 3rd and 4th fingers, the middle and ring fingers. Then manipulate the working strand through the loop with those 2 fingers. And use one of your index fingers to bring the resulting half knot down to the tissue in a flat fashion. The second throw of the one-handed knot tying technique, using the right hand, is set up with the index finger. This time you create your loop by crossing your working strand over your non-working strand by creating a right angle between the 2. Non-working, working. And your index finger is doing that. Non-working, working. Then your loop is created. Your index finger is already through the loop, and now your objective is to get the working strand through the loop. That is done by rotating your index finger under your non-working strand and then over your working strand and bringing it through the loop. And bring the resulting second half knot down to the first in a flat fashion, creating your square knot. So once again, the right-handed, one-handed square knot technique. Rotate, pinch your working strand with your thumb and forefinger. Rotate your last 3 fingers over and on top of the working strand. Cross your non-working strand over your working strand, creating a loop. Use your middle finger to come over the non-working strand and under the working strand, pinning it between the 3rd and 4th fingers. Bring that working strand through the loop, and then bring your resulting half knot down to the tissue. The second part of the one-handed knot tying technique is set up with the index finger. It creates the loop by crossing the working over the non-working strand, by crossing the 2 in a right angle. Your index finger goes under the non-working strand, then over the working strand, pulling it through the loop that was created. When done quickly, the 2 throws look more like this. With practice, you can get good control over this technique. Once again, be sure to bring both throws to the tissue with equal tension on both strands, so you don't convert your square knots or your granny knots into half hitches, which are much more likely to slip. Now for left-handers, use your left hand to set up the knot. Grab your strands, pinch between your thumb and forefinger, rotate your last 3 fingers around, cross your non-working strand in the right hand over the working strand in the left hand. Use your middle finger to come over your non-working strand and under your working strand. Pinch the working strand between your third and fourth fingers, your middle and ring fingers, and manipulate it through the loop. And then bring the resulting half knot down to the tissue, flat. The second throw is set up with the index finger, the left index finger for left-handed tires. Cross your working strand over your non-working strand, creating a right angle between the non-working strand and working strand. Manipulate your finger, which is through the loop already, under your non-working strand, then over your working strand, bringing it through the loop, capturing it between your index finger and your middle finger, and then bring the resulting half knot down to the first in a square fashion. And that is for left-handers. Well, that ends the tutorial part of this knot tying session. The last thing that I want to suggest for those of you who want to take this several steps further is to advance yourself from tying thick cord to actually tying suture. In doing so, I would choose large suture like zero silk. Silk is very easy to handle, and it's easy to learn knot tying with silk. Then I would use large sutures like number 1 or number 2 Proline or PDS. They're large, and therefore you can see your knots well and know if you're tying the knots that you want to be tying just by looking at them. But they have a bit more memory in them and are a bit stiffer, so they're a little bit harder to manipulate than large silk. After using larger suture and silk, I would move to smaller silk, maybe a 3/0 and 4/0 silk, and then also use 3/0 and 4/0 Vicryl ties. You can practice tying these sutures around almost any small objects. Ultimately, I would suggest tying them around small tubular structures like Penrose drains or red rubber catheters, and seeing if you can get a suture to occlude the lumens of these structures. Ultimately, in the body, when we use knot tying, we're usually trying to occlude blood vessels, sometimes small, sometimes large. And then finally, I would graduate oneself onto finer and finer suture. Ultimately, one can try and tie very fine suture like 5/0 and 6/0 Proline, which may be hard to see here. This is done after much experience, and a lot of it is with the feel of the hands more than visually. As a final suggestion, when you're sewing suture that has needles on either end, ideally the end with the needle is not the working end, is not the end that is being passed through the loop. This is a safety feature to prevent yourself from getting stuck. Sometimes, however, you're using suture that has needles on both ends. And in this case, it is safe to bring the needle through the loop because one must do that in order to tie your knots. When doing so, you want to keep your loop loose and bring your needle through the loop without any tension. Finally, one wants to use gloves and do all the same techniques with gloves. And when you can do this, then you're ready to start sewing in the human body. Start tying knots in the human body. And one last suggestion, when you graduate on the finer suture, like small prolines, is to wet your hands. It helps your hands glide over the suture more smoothly. Well, that ends this tutorial. I hope this helps some of you, and I hope it takes some of you further in your knot tying knowledge and techniques. You take care. Bye-bye.